I'd like to share a few announcements before we get started with this evening's presentation. If you haven't already joined our Earth Month Eco Challenge team, there is still time. We've assembled a super-powered team, St. Louis Goes Green, in partnership with 1STL, Earth Day 365, and the EarthWays Center of the Missouri Botanical Garden. Earth Month Eco Challenge is a solutions-oriented engagement program during the month of April that focuses on individuals taking action to reduce greenhouse gases in our atmosphere. It's a fun way to explore existing solutions to climate change. You can learn more at earthmonth.ecochallenge.org. We have a wonderful coffee break scheduled this Friday with Wiley Brown, who's with the Sam Fox School of Design at Washington University. He's going to share his experience with a net energy positive mixed income development in Boston, which is now operational. That will be this Friday, April 16th at 10 a.m. As a reminder, we hold these coffee breaks about every other week to discuss hot topics related to green building and sustainability. Speaking of hot topics, the Living Futures Conference is next week. We are excited to be sending 6 individuals on a full scholarship to the conference. We have invited them to be our featured guests at the April 30th coffee break. If you can't attend the conference next week, join us on Friday, April 30, to enjoy it vicariously through our scholarship recipients. Later this month, we are excited to celebrate this year's Green Schools Quest participants. It's been a challenging year for our schools. So please join us on April 29 at 4:30 to hear about some of the projects the schools accomplished and celebrate their successes. We'll also hear from our keynote speaker, Maurice Moya, a former Green Schools Quest mentor and a climate advisor to the city of St. Louis. Finally, be sure to save the date of our May evening program, which is our annual Green Building Showcase. We'll be hearing from projects pursuing WELL, net zero energy certification, and more. That will be on Tuesday, May 11. I hope to see all of you there. Now I'd like to turn the floor over to Tom Brooks-Pilling. Tom is Vice President of WSP USA. He is also a member of our Education Committee and helped organize tonight's program. He will serve as our moderator. In 1979, a 1979 graduate of Kansas State University, Tom has been a practicing architect working in the St. Louis area for the past 42 years. In his role as Vice President and Architectural Practice Leader for WSP Central Region, Tom leads a diverse team of architects and building engineers to program, plan, and design transportation and institutional facilities that include several award-winning LEED Gold, Silver, and certified projects. Tom, it's all yours. Take it away.
Great, thanks, Anna. So we're going to start off with the breakout rooms, and for those of you who have participated in these before, you know what we're about. We're going to break you into smaller groups of about 5 to 7 individuals each, and we'd like you to consider these following topics that we've identified here. This is just an opportunity for us to get together and learn a little more about each other for the next 15 minutes or so, and then we'll get into the formal part of our presentation. So Freddie, you want to break us into these groups and think about one of these 3 questions that you can see on your screen, and what you might be thinking about as you think about health and climate, and what 2021 means for the USGBC and our 20th anniversary. So Freddie, you breaking us up?
Yes, perfect. Thank you, Tom. We are going to either take a health perspective of what do you look forward to once the pandemic has subsided, And from a climate perspective, where have you been longing to travel since being locked down for the past 54 weeks? And finally, it is our 20th anniversary this year. And so what's the most significant thing that has happened to advanced green building in the last 20 years? So once I hit create these breakout rooms, you'll get a little pop-up on your screen and just hit join room. And we'll have about 15 minutes. Thank you.
Thanks, Brady.
Open rooms. Okay, so you should be able to hit join. Good job. There we go. Let's see. Jill and Frank and Craig, are you guys with us? We need to going to move you to a different room so that potentially you get that pop-up once again. There we go, nice. Okay, and then Jill, I'm gonna move you as well to see if you get that pop-up one more time so you can hit join. And Frank, I'm not sure if you're with us quite yet, but thanks for logging in. We're doing networking right now. So I'm going to see if I can move you around once again to see if maybe you get another pop-up. And then you can just click join. Thanks, Frank. Hi, is this Frank? I'm not sure if I can add you to a breakout room with a call in. I can find out. Let's see if you can hit join. Nice. Oh, hi, Coast family. We are in the middle of networking, so we have about 10 to 12 minutes left. So once you join, I'm going to see if I can add you to a breakout room. Okay, try this and just hit join. We're doing networking, so just join in the conversation. Hi, James. We have about 10 more minutes of networking. So I'm going to assign you to one and you'll get a little pop-up and then just feel free to hit join. We're just doing an open discussion. right. Well, there was supposed to be 5 more minutes, but it looks like it just kicked everybody out automatically. Sorry about that. Is everybody back?
Talking and yeah, we're back. Yeah, having a great discussion and poof.
I know. It didn't even pop up on my screen either. I'm so sorry.
It's okay. So do we have everybody back in the room here?
Yes, we do. Yeah.
All right. So you ready for me to cue it up?
Yes, that sounds great. Thanks, Tom.
Okay, great. Well, let me introduce our first speaker, Lois Sechrist. Lois is a lead accredited professional and manager of environmental stewardship with Medxcel, an Ascension company. And as the environmental stewardship manager for Medxcel, Lois oversees the environmental stewardship program for the 140 plus Ascension hospitals across the United States, working with multidisciplinary green teams integrated into the environment of care committees at each hospital. Through better management and reduced resource use, the economic benefit of sustainability allows money previously spent on energy and waste management, for example, to be directed to Ascension's core mission of providing care for all people. Currently, Lois is leading the team to update and refresh the HospiCycle tool, a start-to-finish guide to help hospitals successfully integrate recycling practices into a patient care setting and better understand the economic, regulatory, resourcing, and infrastructure nuances that come with it. So welcome, Lois. By the way, I'd also like to plug for Lois. She's also a graduate of Kansas State University. Okay. There's a reason for this, Lois. I got called out on a KU thing just a couple of days ago, so I'm kind of fighting back a little bit my own way.
Promoting our alma mater. So
that's right.
Thank you for the kind introduction. So my earlier life was in architecture. I do have a degree in interior architecture from Kansas State and worked for many, many years for St. Louis architecture firms. I was with Jacobs way back when it was Swerdrup, and I was with Arcturus, and then I was with Christner. So with the big recession in 2008, I was given the opportunity to make a career pivot and decided to focus on sustainability and go all in. So that's the work that I've been doing for the past 10 years. And so it's a really great blend of my background in architecture and current work in healthcare environmental stewardship. So next slide, please. Our learning objectives for tonight. I will cover the first topic. I'm going to talk about terminology for climate change and the health impacts. I'll also talk about elements of a climate-friendly building. And I'll also cover point 3, which is vulnerability assessments. So I'm impressed I can say that at 6 o'clock at night, but we'll talk about that a little bit. Jean Ponzi is going to talk about a very, very interesting study that she's doing with mosquitoes and community science. And then finally, Mary Foshage will talk about continuing the conversation that we started last month, with environmental racism in St. Louis, focusing in on air quality and pollution, and talking about how we can create healthier, more sustainability communities, specifically here in the St. Louis region. So that's the material that we're going to cover tonight. We want to keep our presentations short. We would really like tonight to be interactive. So thank you for all the questions that you submitted, and we'll get to as many of those as possible. So next slide, please. Oh, here we go. I'm sorry, back up one. You're good. This is a diagram that I have used a lot over the years, and I would encourage you to download it and become familiar with it if you don't already know it. It's from the Centers for Disease Control, and specifically the the National Center for Environmental Health. So we start out in the center of the diagram with specific health or weather impacts, higher temperatures, extreme weather, and rising sea levels, for example. And then in the ring around that, it illustrates what happens from a physical standpoint and an environmental standpoint. So I'm going to zero in on just one example, the brown quadrant or the segment in the lower right-hand corner, increasing allergens. For the past several years, I've taken photographs of my yard, of the flowers that bloom every spring, so I can keep track of the cycle of what's going to show up next. And I've noticed that bit by bit, things are blooming earlier. And I think we've all noticed that warm weather is lasting longer and longer into each year. So we're seeing more allergies and more asthma as a result from that. So the outer segment of this slide shows the health impacts. So this directly connects weather and human health. So I have, again, found this to be an extremely helpful diagram to refer to over the years, whether you're a beginner or whether you're fairly advanced in this topic. Next slide. The elements of a climate-friendly building. Some of my examples are coming from healthcare. So this list specifically comes from an organization called Healthcare Without Harm, but I think you'll find these themes occur in a number of different resources. So we start with energy efficiency. The first thing that you want to reduce your energy consumption and also your costs. So Tom mentioned in the introduction that in our health system, the money that we save through energy efficiency, we can use that to provide health care. Next, you want to move on to alternative energy and clean energy sources. I'm sorry, you can see on the previous slide. Go back to. There you go, thank you. Using clean energy sources. So we've done a lot of work across Ascension with energy efficiency, and we're now making our first foray into renewable energy and clean energy sources. So we're probably going to be doing additional solar installations and then our first wind energy purchases. So the diagrams I have on this slide, I've got an example of retro commissioning up in the top corner. And then below is Dell Children's Hospital in Austin and a solar array on one of the buildings there. Next elements are conserving water and then also avoiding bottled water. We've got great tap water in many parts of the US, so we really shouldn't be using bottled water where it's not necessary. We're showing solidarity with communities that don't have access to clean water. We're minimizing waste, and we're learning that we're also reducing microplastics in the environment. And then finally, on this slide, food is a very important part of healthy buildings. We want local, fresh, sustainably grown foods, and we want to minimize transportation required to ship food halfway across the country. And we also want to create jobs. So you can see that there's a lot of climate-friendly impacts, both direct and indirect, from these activities. Next slide. Next category that I want to talk about is transportation. And Mary was kind enough to share a photograph of some of the new electric vehicles that the city of St. Louis is purchasing and deploying across several departments. So we want to use alternative fuels. We also want to look at the larger issues of mobility. So I'm super excited that this summer I've been able to hire an intern to look at our fleet mobility. And Hope is scary fast with the internet links. Thank you, Hope. Mobility. So we'll be looking at how people get to and from our healthcare campuses and also looking at telemedicine. So being very creative with transportation in the entire segment of mobility so that we can minimize the need for single occupant vehicles to come to and from our sites of care. Next, the waste category. I think we're up to 6 R's at this point, and we could probably add a few more. And I have added the Stick with the 6 recycling poster, if you're not already familiar with this. This is the poster that one STL is using to try to standardize recycling practices across the St. Louis region. And then finally, of course, near and dear to all of our hearts is green building design. So understanding your local climate conditions, optimizing those building designs using LEED to reduce our energy and our resource demands. So that's a quick snapshot of elements of a climate-friendly community and climate-friendly buildings. Next slide. The next topic that I wanted to cover is what we call vulnerability assessments. So this particular toolkit that I'm referring to is from the US Department of Health and Human Services. They have a web page called climate.gov, and I'm sure maybe in the next few seconds, Hope can pull that up and share it with us as well, that link, so that you have it to refer to. There's a number of different toolkits on this website, whether you're a community member, whether you're a health system, whether you're a school or a corporation, you can understand the climate impacts for your area. So are you vulnerable to fire events, cold, heat, hurricanes? The illustration I have on this slide is one of our hospitals in Jacksonville, Florida. We've got hospitals on the Atlantic as well as on the Gulf. So we get hit by hurricanes at least once a year. We were also hit by the big ice storm in Texas that happened this winter. So you can do planning to understand in your region of the country, whether it's St. Louis or whether you're working elsewhere, what might those climate events be, how to prepare for them. You want to gather together stakeholders. So those could include design professionals, public health officials, government departments, perhaps corporate representatives, as well as community members, and then do maybe a half day or a full day workshop to work through different climate scenarios and events that you need to be prepared for. Understand that your assets, how you need to protect them, and then do your future planning for decision making. Next slide. On that same webpage that I was just referring to, climate.gov, there was a search bar. So I typed into the search bar St. Louis, and I came up with this case study, which is really interesting. It's called Up With the Waters, Flooding and Contamination in St. Louis. And so on this particular segment, there's interactive maps. If you're interested in flooding events and what kind of contamination might occur, there's some very interactive resources available. You can see, you can zero in on different parts of our community to understand, for example, flooding impacts for our region. So this is just one example. I think there's probably 100 different case studies on this website that you can take a look at. So lots of resources available. And then finally, I did want to mention also the USGBC site. There's an entire segment called the Center for Resilience. And I believe Marianne Lazarus had some input into developing these tools for USGBC. So there are segments on design planning, healthy sites, maintaining the project site, and catastrophic events within this resource on the USGBC site. So please take a look at that as well. So this was super quick, just a very brief introduction to a number of resources that are available to you as you do your work moving forward. So Tom, I am going to turn it back to you at this point.
Thanks, Lois. That was a great presentation. Thank you. So now let me introduce you to Jean Ponzi. Jean is the Green Resources Manager for EarthWays Center at the Missouri Botanical Garden. Jean serves as the Green Resources Manager for the garden in St. Louis. She's a 25-year veteran of the garden's EarthWays Center team, Green Jean, as they currently call her. Her applies to her sustainability expertise as the manager of the St. Louis Green Business Challenge. That's what you were asking me about earlier. Operator of the garden's Green Resources Info Service, and on the leadership team for the regional initiative Biodiversity City St. Louis. Her Enviro interview show, Earthworms, has logged nearly 32 years of conversations through KDHX, St. Louis Independent Media, as Jean's volunteer community service. She is in demand as a speaker, a writer, and a media spokesperson, offering local to national audiences both practical options and ecological inspiration. So welcome, Jean, Green Jean.
Thank you, Tom. When that nomenclature came up, it was kind of terrifying because
I can
but
imagine.
I become very fond of her. She, I'm able to keep her on track. It's not just about me, her. It's about mission and, purpose and being of service and educating my fellow humans. I'm ready for my PowerPoint. Thank you, Freddie. This is the best profile picture ever at Busch Stadium. What a coup that was. Okay, so my part of this program tonight comes out of a tiny, tiny little bit of my work that may get to be a little bit bigger, and it really is a passion project, and that is educating my fellow humans about about ecology, first of all, about relationships in place and the value of relationships, and specifically the relationships between pollinators and pests and human health and ecological health. Protect the pollinators and control the pests. Mosquitoes and monarchs has been one of my most popular presentations. I'm going to focus on the bug in the international no symbol here today. Next slide, please. So we have a movement in St. Louis for native plant gardening, for pollinator gardening. Yes, I say that exactly just like that. Eco-logic, and pronounce eco correctly. We have been recognized in St. Louis by Doug Tallamy, the entomologist from the University of Delaware, whose books, Bringing Nature Home, Nature's Best Hope, just released at the end of March, The Nature of Oaks. He is like the guru, the best explainer of why native plants are important. And he's a bug guy. He's an entomologist. He has said St. Louis is a leader, if not the leader, among cities in the country with a movement for native plant gardening. Yes, we still have plenty of boxwoods and petunias, but this is a big thing for us. People get very fired up, very excited about pollinator gardening. And it helps us connect to those ecological relationships. Pollinator gardening is a desire fulfiller, and it also brings up concerns about some of the threats. Next slide, please. Threat and opportunity. Remember that from the I Ching? If you used to throw the I Ching when you were in your 20s, I did. So in my communication about mosquitoes, which really started as a formal focus in 2016, it became very clear to me that human beings of all walks of life, all ages, all levels of education do not get the fact that bug spray kills bugs, period. Now, when we spray bug spray on ourselves in personal repellent, that's different. That's a camouflage. But when we spray out chemicals with the intention of controlling or killing bugs, there is no chemical that differentiates between one bug and another. We haven't gotten to that yet, like we have with genetically modified weed control, for example. And we humans have this massive, in our society, massive love affair with chemical magic. We expect that a silver bullet will get out there, and the agencies that we pay our taxes to keep us safe are gonna do that kind of stuff. My quote there in the presenter slide about responsibility, that little switch of words there, to have that mean and internalize that means our ability to respond, our willingness to take responsibility, to be a partner in that kind of control. That's a big deal. And frankly, in my presentations about mosquitoes and my writing about mosquitoes, now what I have put first is not just dump standing water, but use a good personal repellent. Use that chemical magic where it's going to do the most good right around you. And then use things that are really appropriate for controlling, say, mosquito breeding, not just blasting out the chemical fog. Next slide, please. So an ecological understanding gets us to ask the question, why don't we just wipe out this one species? What the heck, why don't we just get rid of them all? Well, first of all, we are not that smart yet as a species, a dominant species on the planet Earth, to be able to make a decision about eliminating one. They are important food sources. Dragonflies, the #1 predators for mosquitoes. And the understanding about those relationships, about the fact that even bugs we consider pests, things we consider a pest or a problem, has a purpose in the great scheme of things. And how do we relate to that as a responsible participant in that circle of life? Next slide, please. So asking what's the problem, and I'm going to come to the technological option for this at the very, very end, because that is a part of my mosquito work that is frankly the most recently evolving. Getting people to understand that in this one genera, Culicidae, the mosquitoes, which are part of the fly family, there are over 3,000 species. Some sources say over 3,500 species of mosquitoes on Earth. And there are a very small number of species in only 3 genera of this particular kind of insect that carry diseases of concern to humans. Anopheles, Aedes, Culex. This is not much. And not every kind of mosquito, every species of mosquito in each one of these genera carries diseases. So getting people to differentiate between what we see as a bug that is a problem, kind of like when we look at another kind of person that may not look like us or may not have the same values as us and go, oh, that's a problem. This is really important evolutionary stuff for us, Homo sapiens. This is an important question. Next slide, please. Getting people to take a look at the details, observe the details, understand some commonalities, understand some patterns. What do all mosquito species have in common? That insect up in the upper left there, what do you know about that insect just by looking at it? That is a female mosquito. Only female mosquitoes bite. They're taking a blood meal to generate the protein to lay eggs. One of my best punchlines is this is one of the only places in nature where you will look where the guys are not the problem. I'm an old feminist. Another thing that mosquito species have in common, they all breed in stagnant water. They must breed in standing or stagnant water. So moving water is not a problem. But let's say stagnant water, what is left in the River de Pere after a stormwater rush rushes through, that's where the kind of mosquito breeding can happen. And in gutters that are not clean, in those kind of corrugated downspout pipes, any place that water stands, mosquitoes will find it and they will lay their eggs and they will breed. And looking at those kinds of sources and taking responsibility for eliminating those sources in our own yards and in conversation with our neighbors. What a concept. So that we can work together across property boundaries that frankly insects don't respect. Again, good practice for humans. Next slide, please. So differences, when you start observing differences in mosquitoes, this is going to feed into the the app base, the potential pilot that we have for a new level of mosquito control engagement that I'm hoping to and working to seed this year in St. Louis. Look at the difference between these 3 kinds of mosquitoes. Very different body postures, different coloration, different antennae. And frankly, it's exciting to me that observing those kinds of differences is something that gets us excited, even about bugs. Even if you're creeped out by bugs, when you start looking at the different ones, you might be going, ew, but you might be going, ew, that's really different. And that is engagement. Next, please. Okay, so for example, this is Aedes albopictus. Aedes is one of the genera that includes at least 2 species, albopictus and Aedes aegypti, that do carry serious diseases of concern to humans. Both of them, albopictus and aegypti, are known carriers of Zika virus. And when I really got involved in this mosquito work was when the global concern about Zika virus was cranking up back in 2016. And we learned that, for example, this zoonotic disease, this disease that is carried from insect to human, also can be passed from human to human. We're dealing with the same kind of thing now with coronavirus, that kind of vector or that kind of epidemiology, and understanding it and then being able to control it and work with it. This particular very beautiful, very distinctive mosquito, this is one that is not native to here. It's traveled around the world in the holds of cargo ships as we have global shipping. It is an outcome of the movement of stuff that is part of what contributes to all of the issues that tie back to climate change, ultimately. This is a mosquito that is not going to be affected by a fogging truck that runs at twilight because they're active in the daytime. Next slide, please. So look at the difference between the two here. The mosquito on the left, the brown mosquito, same genera, Aedes, but this is Aedes vexans. This is called the common floodwater mosquito. And back in 2019, we had a very wet spring. We were overrun by Aedes vexans. They are aggressive all-day biters. It hurts when an Aedes vexans mosquito bites you. That's not always the case with other kinds of species of mosquitoes, but this is a species that carries no diseases. This is what a public health agency refers to as a nuisance mosquito. And with nuisance mosquitoes, our public health agencies are not geared to, they will not, they don't have the resources to send out the chemical trucks. It's when there's a mosquito infestation that is a known carrier of diseases. And that's another fine point of understanding that we really need to have. This may be another bad year for Aedes vexans. And when that occurs and people are swatting and people are going, oh my God, it's all these mosquitoes, that's when there's a big uptick in business and the chemical fogging companies and all the ads that say, oh, we're spraying with eco chemicals. I don't think so. Bug spray kills bugs. Getting people to understand this is really crucial. And these are simple understandings. Next, please. So this is what the public health agencies have to do. And here we tie into the whole issue of individuals relating to society. We have a huge expectation that St. Louis County Department of Public Health, City of St. Louis Vector Control, any of your municipalities, Public Works Department, they are using our tax dollars and we expect them to keep us safe. And this is the first thing we think of, the truck driving around spraying out chemicals. This is the least effective thing that can be done, because aerial fogging of chemicals only affects the flying insects, which are the adults that it contacts. It does nothing, zero, zilch, nothing to interrupt mosquito breeding. You can have a fogging truck drive down your street at 6 p.m. one night and at 8 a.m. the next morning, Aedes aegypti mosquitoes in this or Aedes albopictus in this much water can hatch out a whole new generation. That's what we have to understand, that life cycle, that ecology. Now, the public health agencies, I just talked to St. Louis County Department of Health and updated some stuff with them this week. They are no longer running regular fogging routes. They only will send out fogging routes when there are documented incidences of mosquitoes, the kinds of mosquitoes that carry diseases of concern to humans, not nuisance mosquitoes. And that's a big change. And it's smart because it's expensive to run these fogging routes and it's totally counterproductive to any advocacy for biodiversity at all, because bug spray kills bugs. Next, this is a not very apparent kind of mosquito control from professionals. This is where we can participate. This is surveillance. This is going out and looking at what kind of bug that is, looking at those details. Mosquitoes are attracted to traps. Gravid mosquitoes are attracted to traps. They are attracted in by emission of carbon dioxide. That's what attracts them to us as we respire carbon dioxide. It's very staff intensive to put these traps out, monitor these traps. It's very essential to track what kind of mosquito is out there when. Next, please. From those traps, mosquitoes go into a lab. And yes, someone sits at a microscope and looks at teeny tiny little squashed, dehydrated bugs under a microscope and identifies what kind of mosquitoes we have in our area. Nobody knows this. Nobody in the public is going to know or care about this because this is like one of those invisible things, right? Like when your mother cleans up after you. But these are really critical kinds of support functions that our public health agencies are doing. Next, please. Visible again. Once we know where mosquitoes of concern are breeding, then an agency will go out and apply a larviciding chemical. Larvicide is really a pretty benign chemical, and the fogging chemicals are a lot less benign now than they used to be when that was originally a practice, like the 1950s and 60s. Larvicide, the conventional larvicide, is Bacillus thuringiensis israelensis. It is a kind of bacteria that occurs naturally in soil. And when you drop little briquettes, or these are what mosquito dunks are, those little donuts you get in the store, the little bits you can broadcast, drop that BTI in water. It changes the spores get released into the water and mosquito larvae ingest it. And they stop, it's toxic to their guts. They stop eating and they die. I like to say it explodes their guts, but that's not totally true, but it's a good punchline. So what this does is it retards, it stops the development of mosquitoes through their evolutionary cycle from little wiggly larvae to little floating commas, their pupae, to when they turn into an adult and aerial kind of mosquito, which is what the fogging targets. So this is effective. And BTI, it's a biological larvicide. It doesn't hurt birds. It doesn't hurt aquatic life. Its toxicity is specific to insects in Diptera, the fly family, which includes mosquitoes. So it's not toxic to honeybees or other pollinators if they tend to take, if they happen to take a drink where BTI is deposited. And yet this too can only be done on public property by our public health agencies. But this is something that we can do on our private property and that we can work with our native neighbors to do. Next one, please. So this is the coming thing. This is something that I've been looking at and wondering about and hoping we could do here since like 2016 or 17, app-based community science mosquito monitoring. This started in Barcelona with an app called Mosquito Alert. People would go out with their phones, they would photograph mosquitoes and they would photograph mosquito breeding sites. Mosquito Alert for a long time was only available in Spanish. It is now available in English. It's an open source, community science-based app like iNaturalist or eBird. And my dream has been to pilot this in some of our neighborhoods because people have their phones with them all the time. So successful in Barcelona that incidence of mosquito-borne diseases went down to almost nothing, and they established a Department of Biodiversity within the city of Barcelona. So, cut to the chase. Last year would not have been a year to try to do this because every public health staffer that I know was moved on to contact tracing or that kind of work to deal with COVID-19. To this year, I think we're going to have a little bit more latitude. So City of St. Louis Vector Control and Health Department is on board. Thank you, Janine Arregui, who's here tonight, who just retired from that team, for taking that up to Dr. Eccles, the head of City Public Health before you retired. St. Louis County Public Health would very much like to participate with a pilot. And we've had one phone meeting with John Palmer at the University in Barcelona, who developed this app, and it's gone through several iterations. And there's one other possible pilot in the US, in Florida. So we have community science. This is a rebranding too. It's always been citizen science. the new term is community science, which is much more inclusive, particularly as citizen, non-citizen, that level of otherness has become a sensitive point for us. Community science engagement. I am anticipating and going to do my best, even though I am not techno girl and I am not data girl, I'm word girl, to lead a charge to pilot use of this app and make sure that the data will get into the workings that public health agencies need. That's the way this app has been configured, so that we add the eyes and the intelligence of many individuals, of our own ability to respond to the limited capacity of our public health agency to do that surveillance, to be able to do analysis. You have to have professional entomologists in on this too. Have had conversations with 2 mosquito girls at Tyson. Great opportunity for students to participate in mosquito identification validation. And this is, to me, this is using some of the best of what humankind has evolved, which is our love affair with the personal mobile device that, tends to run our life. Couple that with our connection to nature, one of the great gifts of the year of the pandemic, the fact that we could go out into nature, and get that to send information and mobilize the forces of the pollinator advocates and the ecological gardening advocates, and multiply the capacity of our public health agencies. Last slide. So this is the other thing you can do. You can control standing water. You can deal with standing water. And yeah, you can use a good personal mosquito repellent. That really is number 1 on the chemical list. But engaging people, because I know that, this is nice, but it's not all that exciting. People want to do something that is exciting. And that is what I hope we will be able to pilot, at least in one city neighborhood, perhaps in 1 or more municipalities this summer, to ramp up our capacity to control a pest while protecting our pollinators and using the best resources that we have developed for the good of nature as well as for us. Thank you.
Well, thank you, Jean. That was really quite powerful. Thanks so much. Green Jean, there we have it. So our third speaker tonight is Mary Foshage. Mary is the air pollution inspector with the City of St. Louis Department of Health. And she states, from the Lorax as a child to raising her daughter to appreciate the interconnectedness of everything, Mary has been a lifelong environmentalist. Mary received her degree in environmental studies from Oberlin College and worked at the Washington University School of Medicine, Siteman Cancer Center for 20 years, developing a program in support of the National Cancer Institute grant. She transitioned into the environmental field in 2018 as an environmental specialist for a scrap metal business, supporting field technicians, and as a zero waste captain at the Hollywood Amphitheater, sorting garbage. Now, as an air pollution inspector for the City of St. Louis, Mary has the opportunity to work with a wide variety of people and organizations to influence policy and work toward a sustainable future. Welcome, Mary.
Thank you. I wanted to say thank you to everyone who is participating tonight. It's great that you share your time and energy with us. I also wanted to say thank you to our coordinators for inviting me to present and giving me this opportunity. Next slide, please. So this is another visual representation similar to what Lois had up as her first slide, slightly different way of looking at it. It came from a report by globalchange.gov. There's a lot of information available on that website, specifically about climate change and health. This report summarizes the impacts of climate change in the United States specifically, both now and in the future. Just a visual representation of the interconnectedness of everything. This was prepared by a team of more than 300 experts. and extensively reviewed by the public as well as experts in the fields. Basically, as we have already discussed, climate here in the Midwest specifically is getting hotter and wetter, and that part is going to continue, and that definitely means an increase in air pollution, water quality issues due to overflow, and also patterns of infection, similar to what Green Jean was telling us about mosquitoes. That's a vector controlled source of disease. There's also waterborne sources of disease and foodborne sources of diseases. And right now, we know what those patterns are currently, but we also know that those are changing already, and they are going to continue to change. And that's really going to affect health on a lot of levels. One of the things that we haven't really touched on so far in this presentation, but that I did want to mention, is the effect of climate change on mental health. Okay. But basically, the conclusion of this report was that climate change can affect health in two ways. First, by changing the severity or the frequency of the storms that we experience and the health impacts as a result of those storms, but also by creating health problems in areas that did not see them before. Next slide, please. All right. So, according to the WHO, climate change is impacting human lives and health by threatening the essential ingredients of good health, which is clean air, safe drinking water, nutritious food supply, and safe shelter. All of that has the potential to affect human health. Between 2030 and 2050, climate change is expected to cause approximately 250,000 deaths per year from malnutrition, malaria, diarrhea, and heat stress alone. And this is expected to cause an estimated $2 to $4 billion a year in health costs. One of the best ways that I think we can all agree on to reduce specifically greenhouse gases and then air pollution, as is my focus, is through better transportation, like several of us have talked about tonight. Our food and energy choices also impact health. And here I have pictured the Paris Agreement, which I think we've all heard of, so I'm not going to explain what it is, but it's one of the first global recognitions of the fact that we have to work together as a globe to address these issues. Next slide, please. So in particular, the effects of air pollution on any community. There has been linked to diseases of the lungs, specifically respiratory diseases, bronchitis, asthma, emphysema. And this is expected to increase with climate change because air pollution is going to increase. The amount of particulates in the air is already an issue in many countries. And like I said before, those effects are going to be shifting to different areas to affect different people. And those communities may not be prepared for what they are going to get. Right now, around the world, 9 out of 10 people breathe unhealthy air. So it's already an issue, and it's definitely going to become an even bigger issue. Next slide, please. So one of the issues that I realized in my current position especially, but also just in observing environmental issues and climate change in general, is the issue of environmental racism. The definition is there on the slide. Basically, we have learned, and it has been supported throughout scientific literature, community studies of all kinds, that minority groups are disproportionately burdened with any number of hazardous situations. Climate change is definitely going to impact lower income and minority group communities the worst. Next slide, please. There was a study to that end done here in St. Louis on environmental racism. And please, if you have not taken a look at this report, please do look it up. It's at environmentalracismstl.com. And the conclusions of this report basically support the fact that we are experiencing environmental racism here in St. Louis every day. At the end, it calls for us as St. Louisans to work to get access to safe, affordable housing, clean air, reliable and affordable public transportation, healthy food, and neighborhood-based revitalization efforts. Next slide, please. So there is a lot going on here in St. Louis in regards to climate change. The mayor's office created an Office of Sustainability fairly recently. Catherine Werner directs that office. The mayor's office also came out with a sustainability plan for the city. Again, please take a look at that. It's got a lot of great information on it, and our Representative Cori Bush here has taken this on as a topic for her time in office. She wants to be able to direct federal aid more appropriately, basically, is her goal for that push that she has going on right now. Next slide, please. In addition to here in St. Louis, there are also, of course, national organizations that are addressing climate change. But here in St. Louis specifically, the health department is working with the building division through Healthy Demos and the Vacancy Collaborative to try to address air pollution and environmental racism, really, from the demolition point of view. One of the newest things that is going on in the health department air pollution control program right now is a program called deconstruction instead of demolition. And it fits really well in with what we're talking about here today, because not only is it a more environmentally friendly way of bringing down a building, it also involves scrapping, salvaging as many materials from those buildings as possible and creating a market for resale of them. But in addition to that, deconstruction requires many more jobs than traditional demolition. And so it's a job creation for us here in St. Louis immediately, as well as the domino effect that will happen as we feed into the salvage companies and distribution around the country. So there's a lot of exciting things going on here in the city. especially with the Department of Health, working with the mayor's office and the building division. Next slide. If anyone has any questions specifically about air pollution or generally about climate change and how we're addressing it here in the city, please don't hesitate to reach out to me. Thank you guys for your time.
Fantastic. Great, great presentation, Mary. We really appreciate that. So we have about 45 minutes left in our time together tonight. And we have a whole bunch of questions that folks have posed to us. And I'm going to be the moderator of those questions for the next 45 minutes or less. So I'm going to start with some that came in before the presentation started tonight, and we'll go from there. So my first question will go to our first speaker, Lois. And Lois, this one came from Marianne Lazarus, as a matter of fact. And the question is, can you help make the business case to address climate through improvements to health and wellness?
Marianne, that is a great question. And it's actually a category of work that I'm becoming very involved in. So we refer to that in the healthcare biz as the social determinants of health. And so we're looking at jobs, housing, transportation, access to healthy food. It's been said that up to, I think, 10% of an individual's health outcomes can be related to their environment. So waste management, pollution, clean water, all of those things get categorized into what we call the social determinants of health. And we are working on a number of those items. We've joined an organization called the Healthcare Anchor Network. And initially, I didn't really understand what that meant, but it was explained to me that health facilities, as well as schools and universities and other types of institutions, we're community anchors. So we have to be operational 24/7, no matter what. You know, I showed you that photograph earlier of our hospital in Jacksonville that Tom worked on as an architect, getting hit by a hurricane, and it still needed to be operational no matter what. So that community anchor. So, and we've seen it in St. Louis with the improvements to the SLU hospital neighborhood, the BJC hospital neighborhood, other locations where you have to work beyond the walls of the hospital and spread out into the community with better transportation, better housing, access to food, keeping the area clean. So all of those things contribute to the business case for mitigating climate impact. Specifically in Chicago, with some of our Chicago hospitals, we're focusing on creating jobs directed to women-owned, veteran-owned, and minority-owned businesses near the hospital to create a more stable and healthy community. So the answer is yes.
Yeah, apparently so. Strong business case, no doubt about it. Jean, one for you. Have any area municipalities, are you aware of any that have discontinued fogging?
I am.
And
Yeah, go ahead.
and what prompted their decision? And what are they doing instead?
So last year, Collinsville, Illinois, made the decision to discontinue fogging. And they made the decision because it's not effective. And frankly, I think you could ask any public health department vector control person, do you think this is effective? And they would say, no, it's not the most effective thing. It's not, because, you know, as I said, fogging does nothing to interrupt mosquito breeding, and it's costly, and it, you know, some people really want it, but other people get very up in arms around it. I had understood that Brentwood had also made the decision to discontinue fogging, I believe in 2018. But in my conversation earlier this week with Jim Sayers of Vector Control in St. Louis County, that there's a little bit of a variation on that. So I need to keep up to speed on who's doing what. Most of the municipalities in our area, it's my understanding, contract with their county agency to run fogging routes, because that larger governmental entity has the person power, they have the budget, they have the fleets. There are just a handful of municipalities that run their own fogging routes. That said, there's one not too far from me that decided right after Brentwood figured they'd pull the plug on theirs, that one was going to run fogging routes 3 nights a week instead of only 1 night a week. So there's a lot of variation. Cost is a factor. Public expectation is a huge factor. And if you are going to make the decision to cease offering that service, I feel strongly that that has to be coupled with alternatives and messaging that comes from multiple places. Like Lois, you showed the recycle responsibly, stick with the 6 graphic there. That's a regional message that so many organizational recycling advocates are pushing out. And there are still variations in that. Some municipalities don't take glass. Some of them want you to, blah, blah. But a general message and a movement, a culture of awareness and practice and communities of practitioners that work together, that is a real key to success. And I think we'll see a strong response from municipalities, maybe after some initial pushback, but what the heck, got to work at it.
Yeah, exactly. Thanks, Jean. Mary, one for you, and this kind of builds on something you said at the conclusion of your presentation. So St. Louis is apparently posed to receive about $500 million from the American Rescue Plan Act of 2021, just recently went through Congress. And what are the 3 top actions in your mind that our leaders could take to jumpstart solutions that address environmental racism and air pollution in the city of St. Louis?
Oh my.
I know it's a toughie.
Wow. I would like to ask others to speak up too, because I don't know that I could come up with 3 to address environmental racism. It's not my primary focus of research, so I apologize for that. In terms of things that could be done that I know about, has a lot to do with demolitions and air pollution, of course. But if we can, one of the first things is to alert the general public about where demolitions are going to occur, for example, so that individuals can take appropriate action to protect themselves. From a governmental point of view, there's a lot that we could do, and there is a lot that we are working on. And we do definitely want community input on this work as well. There are internal work groups who are addressing the lack of equity in the way that things are enforced across the city. And we could definitely use funds to support the work that is being done there. It has a lot to do with our accreditation, the Department of Health's accreditation, to address some of these issues. And it, of course, involves more staff, more time than our usual jobs allow for. So I know that's not a complete answer, but there are groups of people within city government who are working to address equity issues currently.
Great, thank you. I know that was a bit of a hardball, and
That was a tough one.
I know. I appreciate it though.
Yes.
So another one for you, Lois, and this comes from Steve Andert. I'd like to know what measures healthcare systems are considering to decarb their own facilities, operations, and how they might view the value in human health terms. Did I say that right?
Sure, yeah.
Okay.
So I'm going to kind of build on the answer I gave to Marianne a couple of moments ago, and your timing with your question is perfect because we are looking forward to our next 10 years. And so we just finished an engagement with an outside consultant to help us set our strategy, specifically on decarbonizing. So the things that we're going to be doing is making, as I mentioned earlier, our first foray into renewable energy. We just haven't made that commitment yet on a large scale because we can't convince our number crunchers that it's a good long-term investment. So we've worked the numbers backwards and forwards and sideways, and we're ready to do that. The cost of renewables is on par with fossil fuels. So we don't want to be using fossil fuels, and it's now cost effective. So there's no reason not to do it. So we're going to be signing some long-term contracts, probably for some wind energy purchases, and also building our own solar installations on some of our facilities. So that's one item. So that will take care of our scope 1 and scope 2 emissions. And then we're also reaching out to our supply chain. And this is really hard because scope 3 emissions is still pretty ambiguous. There aren't real solid measurements. And so we're going to be reaching out to our primary suppliers to get them to reduce their carbon footprint, or else we're not going to buy their products anymore. So since we're really, really big, we can use that dollar, to move the needle, if you will. And so we're going to be reaching out to our primary suppliers to collaborate with us on better packaging, better shipping, reducing our scope 3 emissions, and mobility. I also talked about mobility. We're going to green our fleet, and we're looking at trucks and snow blowers and landscape equipment and all that, all those very practical sorts of things. So we're going to be testing, snow removal equipment in Wisconsin and making sure that it can perform. So a lot of really exciting work that we're going to be doing. And then the last piece of it is our investments. Also, we've got a pretty sizable investment portfolio, and we'll be making green investments and issuing green bonds. So lots of good work.
Yeah, that's exciting. Ascension's doing some fun stuff. So Jean, here's another one for you. The community science mosquito monitoring pilot. What kind of partnerships are needed to make that work?
This is so daunting in some ways because I am so not tech girl. However, apparently the first one from the developer of the app was professional entomologists, so that you have expertise to validate mosquito observations. And I said, how many entomologists? At least one. So far, we have 2, and that doesn't even count graduate students. The communications channels, the technical linkage between an app like Mosquito Alert and the information management systems that our public health agencies have, that is a question that has yet to be addressed. That's a kind of question that someone like Jim Sayers from St. Louis County Public Health would ask in a next meeting with John Palmer, the developer of Mosquito Alert. And I'm saying these people's names because this is like this many people at this point. This is not like, a movement, although there has been a global study about the efficacy and the validity and the importance of this kind of app-based community science engagement that the Woodrow Wilson Center for Science in DC did, commissioned by the United Nations. So, and then, promotion, publicity, partnerships. I look to the circle of biodiversity advocates that are part of our Biodiversity St. Louis network and the pollinator gardening advocates to be the cavalry of getting that kind of message out to the general public and helping to popularize the process of using this communication method.
Cool, cool. When I saw your slides, I looked online to see what that was all about, and it's quite fascinating. There's no doubt about it. Mary, here's another one. Hopefully, it's not too tough. But this one, did you see in the paper over the weekend the issues with the city's community of Centerville and their sanitary and their stormwater system? I mean, these people are basically, it's pretty rough. These people are living in sewage, and nobody's doing anything about it. And it's frustrating, and clearly it's an issue of environmental racism as far as I'm concerned. So why does this happen? Does anybody, I don't understand how people could be living in I realize they're living in a floodplain and they're living in low land, but how can anybody allow their storm and sanitary systems just to go, just go bad? Got any opinion on that?
Well, I do know that we have had an issue here. I don't know the details of it. It was before my time with the city, but the MSD and the EPA.
Yeah.
And I mean, I think, in my opinion, that was at its core about, lack of infrastructure maintenance for sure, which it kind of sounds like this is the case too, but it's the poorer neighborhoods who are bearing the brunt of that, because that's where the least activity of infrastructure maintenance takes place. Why that happens?
Yeah.
I don't know.
Why it happens is disposable others. Disposable others.
Well, yes.
Ideology that, it's an ideology. And I was on another webinar, they talked about underserved. Who chooses to underserve certain parts, certain neighborhoods? So, disposable others, there's a gap. And they don't get their property taxes worth.
Yeah.
And to echo my little quote there with my bio picture, we all are responsible for that. And we all have a role in it, and we can all do something to help. And it's one of the greatest things that I have learned in my role with city government is that all I had to do was speak up. And now I am part of like 5 committees on equity issues. So yeah, there's a lot of work to be done, but we each can do it together,
Yeah, absolutely. I think, being aware of what's going on and makes you want to take action. There's no doubt about it. So continuing on with the political issues, another one for you, Lois. Why is climate change a political issue, and how can we make it not a political issue? This is from Katie Mueller.
Katie, excellent question, one that I have had to deal with quite a bit over the years. You just don't. So I work for a very conservative organization. We're in Wisconsin, Michigan, Texas, Florida, Kansas, Oklahoma, just about as conservative as it comes. So we have decided not to really worry too much about is climate change man-made or is it not? I mean, it is, and I'm not afraid to say it. But what we really do talk about is resilience and mitigation. Here it is. I showed you the photograph of our hospital on the St. John River being swamped by this hurricane. So whatever the cause, we have to be operational, we have to be resilient, we have to plan ahead, we have to provide health services. So here we are. The power outages and the extreme cold in Texas, in January and February. Here we are. So, and in many of the states where we're located, we have to work with politicians on both sides. So we just find that common ground. We talk about issues that we can agree on. If we can save money with energy efficiency and resilience and facilities that are easier to operate, we can save money and apply that to healthcare. If we can ask to have recycling mandates in individual states and as well at the federal level, then that helps fund our programs and it will create jobs and spur innovation. We've seen it happen in the construction industry. We changed the construction industry by demanding green products and green construction methods, construction waste diversion. We're creating jobs and we're creating great buildings and great schools. So just talk about the things that we can agree on and get to work.
Absolutely. Great.
Can
Great.
I add a comment on that, please?
Yeah.
So we've had the extraordinary opportunity over this past year to share an experience across the entire human species where the threat targeted us and it didn't matter if it was wrong and we hated it. Does not matter one iota to a virus. So our default, our species default of identifying other and pointing to other and saying it's their fault, it's their responsibility, they're bad, they're wrong. We've had the opportunity to be like toddlers in timeout for this past year. And this is an audience that is inclined toward this stuff in the first place, but what kind of introspection are we engaged in, have we engaged in, and how can we apply that to our work in our different specializations to be able to have conversations that don't get stuck in that, that duality of otherness. And what have we learned in ourselves, in our individual self, about responsibility and our ability to respond? That was my little quote that I put up there. And the fact that if we work together to take on these challenges in the areas where we work, you don't have to do everything. Nobody has to do everything, but engaging with the work and engaging with one another. And if you want to look at a great way to have conversations about climate change, the St. Louis Zoo's Climate Communications Initiative is coming out of social science research that is based on how human beings react when you have a conversation and how you can open a conversation in a way that doesn't pull those triggers.
Fascinating. Thank you for that additional info.
You're welcome.
So let's continue with you, Jean. So if the best way of mitigating mosquito infestation is to remove standing water, right? Is there a duration in which water can stand before a mosquito begins breeding, or are the risks almost immediate?
No, they're not almost immediate. So for example, if you change the water in your bird bath every day or every other day, which you would want to do so your birds are not eating, bird poop filled water, that's good. That's good enough. However, in low-lying parts of your property that may tend to be soggy, mosquitoes just don't have to be in liquid water. They can be in soggy turf too. Mosquito breeding, mosquitoes go through their instars, their different stages of development from egg to adult much faster in hot weather than they do in cooler weather. Tyson completed a study and they published a paper about whether or not, particularly Aedes albopictus, is becoming more prevalent because our winters are shorter. So the downtime for mosquito season is shorter, and mosquito reproduction. There's a lot of variability there. And yet I think we can have a basic understanding of what is happening with a species like a mosquito and what we need to do to make sure that that hospitality is not something that we are perpetuating. It's harder with stuff like corrugated drain pipes, or if your neighbor doesn't ever clean out their gutters. It's hard in a situation like the River de Pear, where you have standing water and that's running through many different kinds of neighborhoods. It's hard in places where there, you know, the sewer pipes leak or the infrastructure is not functioning. So having a good understanding of the issue, the points of possible intervention, and how to work on that intervention on a regular basis. Those are some of the keys to success.
Great, great. Good to know. Don't want to get those puddles picked up right away. I've got a day or two. That's good. So, Lois, question for you. How do you leverage data to inform decision makers that sustainability should be prioritized when programming new buildings? This comes from Craig Webster.
Such a good question. Data is such a challenge. It's really, really hard to get good, reliable data. So I talked earlier about Scope 1 emissions. That's what you burn and consume on site. Scope 2 emissions are what you purchase primarily from a power plant. There's some other things that factor in, but essentially that's what Scope 2 is. And then Scope 3 is everything else. It's transportation, it's your suppliers, it's travel, lots of other things. So it's a real struggle to get that data. Waste management, you know, we're working with that right now to get our arms around our waste data for 140 hospitals across the country. So whether you're working with just a couple of facilities or you're on a bigger scale, data is a real challenge. So what we try to do is look to reliable sources. So Energy Star is a really good source of data for buildings. USGBC, industry organizations. We get involved in an organization called Practice Green Health, which has done benchmarking studies year by year. So if there's an industry source that you can reach out to, that's helpful as well to build the business case. So when you're at the outset of a project, it's absolutely a challenge to get the right data and the right numbers, the right financial information. So my advice would be to know your silo, know your industry. I don't know, Tom, you might have some insights there as well that you'd like to share.
Well, you know, it's always looking at your comparables, right? Looking at your comparable institutions, talking with them about what they're doing, where their successes have been and where their failures have been. And that's a nice start. And then another strategy is to actually go to a lateral move, look at places that are different but the same, and see what their experiences are. So it's just a matter of gathering data and looking at it from multiple different directions. And in our organization, we have a bunch of folks that are looking at similar circumstances across a variety of different client types and building types. So
I think there's probably some other folks on the call that might be able to share. Steve O'Rourke, I'm gonna pick on you to see your thoughts on that. And if anybody else wants to chime in.
Well, I think you're right. I mean, data is the key, and I think you can argue whether that's the right data or not. But I think when you present data, you have a much stronger leg to stand on than if you're doing it based on a gut feel. You're saying, well, I just think that we ought to do this, but it's like, well, if you provide some data to back up what you're saying, It's like we've gone out, we've collected the data. And if somebody wants to refute your data collection methodology or the validity of the data, you can have that conversation, but at least it's an intelligent and rational conversation rather than an emotional conversation. So I applaud those folks who are out there doing the hard work to collect the data, and it's like, okay, if somebody has a better idea, but we're not going to stand here and do nothing. So.
Thanks, Steve.
Sure.
So more questions for our panelists here. Let's see what we've got here. Lois, here's a question for you. So what are the biggest health risks from climate change that could impact the bi-state region? And what can we do as individuals to mitigate those risks?
Gosh, I think we can probably all answer that. The biggest health risks, flooding, heat, humidity, exposure to sun for anyone that has to work outdoors. Conversely, in the winter, wind and cold are all going to create health impacts. Those vectors that Jean was talking about, being careful about vector-borne diseases, West Nile, tick bites. The list goes on and on and on. Spiders. Susan mentioned spiders. Yeah, I've got a few brown recluse in my house that I need to stay away from.
Yeah, definitely stay away from those.
You used to, this is Susan, used to count on winter kill to wipe out all the spiders, but not so much.
Mm-hmm.
No,
Yeah, we don't get those hard freezes as much anymore.
Yeah, so Jean, what diseases from mosquito bites are we at risk of getting here in Missouri, in the Midwest, bi-state area?
West Nile virus is a whopper. St. Louis encephalitis. Those are both viral diseases. Both of them encephalitis that attacks your brain, swelling in the brain. Dengue fever, I don't know how much incidence we have of that. That's also called bone break fever. It's very, very painful.
Ooh.
We have not had incidents of Zika virus in St. Louis, but that was what came up in 2016 that started a lot of communication among health agencies. Zika being the cause of horrendous birth defects, really particularly affects pregnant women and their developing fetuses. And people itch from mosquitoes. But we have this attitude that the bugs are bad. And frankly, what's happening, I hark back again, I referred to Doug Tallamy, the author of Bringing Nature Home. We are decimating insect populations along with plenty of other populations. Thank you, Homo sapiens. But insects play such a vital role in our ecosystems in ways that we are not even aware of. So forming a little bit better relationship between humans and insects, and that doesn't mean you have to have them crawling all over you, but the big vector-borne, mosquito-borne diseases that are the issues here are particularly West Nile virus, St. Louis encephalitis. And I speak from personal experience. A member of my family had West Nile virus in 2007, probably got bitten by a mosquito at our house in the city, really, really overworked, and resistance was down, and A, survived, and B, recovered from having both legs be paralyzed and will take seizure disorder control medication for the rest of that person's life. So these are not diseases to mess with in the same way that we know COVID-19, another viral borne disease, is not one to mess with.
Wow. Yeah, get those repellents for sure.
Might be rare, but don't let rare make you think it's not going to happen to you, which a lot of people are thinking about. We're hearing how that happens with COVID-19. Not going to happen to me.
Yeah, no doubt. All right, well, here's a 2-point toss-up for the group here. If anybody can take this one on. How do you challenge the non-believers of climate change? And this comes from Kim Vonderheide. How do you challenge them? Who wants to take that on?
So we do talk about science-based. When I talked about we're looking forward to our next 10 years, we're going to be setting science-based targets and science-based goals. When we talk about climate change, we talk about science. And also the things I mentioned earlier, we still talk about resilience and being community anchor and being available. And just talking about the world that we have right now. But for the most part, I try not to get into arguments with folks. It's fairly unproductive, and we just do the work and try to be a leader.
Well, there you go. Any other thoughts on this panel?
Ask the question again, please.
So what do you do? I mean, how do you challenge the non-believers of climate change?
I think we just have to go skirt around that question of belief. Belief is rooted in feeling. Belief is rooted in emotion, and it's rooted in the kind of feeling that says, I'm right and you're wrong, where people's identity is invested in what their belief is. So this is one of the ways in which that climate communications function works. You start by having a conversation around a fact. So for example, if you're talking to someone who is a fiscal conservative, talk about the money that can be saved with energy efficiency. When renewable energy starts to get much more affordable, you can talk about the money that you can save with renewable energy. And you don't even get into the miasma that you can probably assume with, in some dynamics, you can often sense it, is going to come up if you get into the area of belief. Belief is valuable, but belief is a kind of determining factor that you almost can't work with, especially when a society is as polarized around beliefs as we are right now.
That's a great point, no doubt about it. So we've probably got time for just one or two more questions as we come to the conclusion of our event this evening. Let's go to Susan Armstrong. Susan asked this question. How do we recover economic growth and maintain the glorious break from transportation we experienced during the lockdowns? And yes, I think we were talking in a chat room a little while ago. Our environment has improved significantly since we haven't been driving around, right? Or pumping out industry. So how do we keep that going? Anybody have any thoughts on that?
So my organization has decided that we're doing a fine job of working remotely, and we are not going back to the office for the most part. And when we recreate our offices, they're going to be collaboration centers. They're not going to be offices. We won't be traveling nearly as much. I love visiting our hospitals in other parts of the country, but I don't need to for the most part. So we're getting really good at this stuff, at Zoom, telemedicine. We're doing a lot more of that. We dove in head first and we realized it's working out fine. So just a lot of changes that we have made will probably be permanent.
It's amazing how things like this, COVID, have created some amazing results. Some good effective change, which is interesting. So it's 24 after the hour. I'm going to go with one more question. So what data is available, and this one may be for you, Mary, what data is available about potential correlations between climate change and cases of lung ailments like asthma?
There is a lot of data available for that. The American Lung Association would be, if you're asking for sources. But then I do know here in the city, in the Department of Health, we have epidemiologists who collect that data and analyze data to help us, direct our efforts. Repeat the question again, to see if I answered it fully, please.
Sure. What data is available about the potential correlations between climate change and the cases of lung ailments like asthma?
Okay, so it's really endless. Almost any climate change article that I have read mentions lung disease or the effects of air pollution in general. So there is a lot of data out there that shows things like hospital ER visits, emergency department visits increase, that correlates with an increase in the local air pollution. Does that address the question?
Yeah, I think so. I think so.
Okay.
Thank you very much. And I want to thank Mary, Jean, and Lois for a fantastic job as panelists in this interesting topic, the intersection of climate change and health. And if we still have Hannah available to make closing, or maybe it's Emily, or I can certainly do the closing. So up to you guys. Emily, you going to be on? All right, I'll take care of it.
Go for it, Tom. I don't
Okay.
have the document open.
Okay, well, I have it printed out, so I'm good. So thanks to our panelists this evening. We're so grateful that you could join us to share your perspective. And thank you all for those of you who attended and for sending in your questions for the panelists in advance. That really made for a great Q&A, no doubt about it. And I wish we could have gotten to all the questions. We probably only touched the surface. Don't forget about all our great upcoming events, including this Friday's coffee break on net positive energy mixed use housing. And also don't forget about the Green Schools Quest celebration coming up on April 29th. Be sure to check our website for any upcoming coffee breaks and benchmarking and energy efficiency trainings. And we hope to see you all at the annual Green Building Showcase coming up on May 11th. And we have a lot of great lineups, let's try that again. We have a great lineup of projects to feature. So thanks you all, and have a good night, and drive home carefully. Oh, wait a minute, you are home. Take care, everybody. Thank you.
Thank you guys. Great job, Tom. Great job, everybody. Have a great evening.